You're about to look at your own 2 feet in a way nobody at a doctor's office has ever asked you to. Most people think diabetes shows up in a blood test. One vial, one number, one phone call. But your feet were keeping a record long before that vial ever got filled, years before. Tonight I'm going to teach you to read what's written down there, in skin and nerve and blood flow. In plain English, you can use the moment this video ends. My name is Dr. Thomas Grant. For more than 35 years, I practiced internal medicine and geriatrics, and I sat across from thousands of older patients who'd been told their sugar was fine right up until the day it wasn't. I'm retired now. I started this channel for one reason: to build a community of 100,000 people over 60 who refuse to be rushed through their own health. So here's my promise for the next 20 minutes. I'll show you the signs your feet use to warn you, the real reason each one happens, and exactly what to do about it. And near the end, I'll hand you a simple tool you can run tonight, in your own bedroom, in about 2 minutes. No equipment, no cost. Just keep watching. Let me give you a way to think about your feet that'll make every sign today click into place. I call it the Outpost Principle. Picture your body as a country. The heart is the capital. Busy, warm, well supplied. Your feet are the farthest outpost on the map, sitting at the very end of every supply line. Blood has to travel the longest road to reach them. Nerve signals have to cross the greatest distance to report back. And that distance is exactly why your feet matter so much. Principle 1. The outpost feels shortages first. When the supply lines start to narrow, when blood and oxygen and the repair crews run short, the capital barely notices. The outpost goes dark first. So your feet show damage years before your lab work does. Principle 2. The feet carry 2 messengers. Nerves carry feeling. Blood vessels carry supply. High blood sugar wears down both at the same time. That's why some signs are about sensation, and some are about color, warmth, and healing. Principle 3. Quiet does not mean fine. The outpost rarely sends up a flare. It sends small, easy-to-ignore notes. A little numbness. A heel that won't soften. Cold toes under a warm blanket. We explain them away. We blame age, weather, the wrong shoes. But each one is a dispatch from the edge of the map. Keep that picture in your head. Capital, supply roads, distant outpost. Now let's read the dispatches, one by one. The first sign is the one nearly everyone has already felt and already brushed off. Tingling and numbness in the feet. You know the feeling. Pins and needles, like your foot fell asleep, except you weren't sitting on it. You were just standing at the kitchen counter. Most folks chalk it up to a bad position, or to getting older, or to a long day on their feet. They wiggle the toes, it fades, they forget it ever happened. Here's what's really going on. Remember the outpost at the end of the long road. The nerve running down to your foot is the longest nerve in your whole body, and it's wrapped in a protective coating called myelin, the way a country road gets a smooth layer of pavement so traffic moves fast and clean. When blood sugar stays high year after year, sugar molecules stick to that coating and chew it up. Potholes form. The road gets rough. Now the signal, the mail truck carrying the message from your brain to your foot and back, arrives late, rattled, and sometimes not at all. That static on the line is what you feel as tingling. Doctors call it peripheral neuropathy. Peripheral just means the outskirts, the edges, the parts farthest from the center. Neuropathy means the nerve is hurting, and you got lucky if all you've felt so far is a little buzz. Because here's where that road leads, if nobody repaves it. The numbness deepens until you can't feel your own foot. You step on a tack and don't know it. You wear a shoe rubbing a raw spot and feel nothing. The body stops warning you at the exact moment it needs to most. I've sat with patients who walked in with a wound the size of a quarter and swore they had no idea it was there. That's not carelessness. That's a phone line gone dead. The American Diabetes Association estimates that nearly half of people with type 2 diabetes develop this nerve damage. Half. And it almost always starts in the feet, because the feet sit at the end of the longest road. So what do you do, starting today? Walk. Not a run, not some workout that scares you off by day 3. A steady 20-minute walk. Walking pushes blood down into the tiny vessels that feed the nerve coating, and that supply is what gives the nerve any chance to hold its ground. And at your very next meal, pull back the added sugar. Less sugar in the blood means fewer molecules sticking to that nerve road. You don't fix this next month. You start at supper tonight. The second sign flips something you've believed your whole life. Cracked, hard heels that no lotion seems to fix. I want you to really hear this part, because it's the conversation your 5-minute appointment never has time for. You've been told dry heels are a moisture problem. Rub in more cream, drink more water, blame the winter air. So you buy the thick foot balm, you slather it on, and within a week the cracks are right back. You decide your skin's just like that now. That's age, you figure. But it isn't a moisture problem, it's a wiring problem. Here's the piece almost nobody explains. Your skin runs its own built-in irrigation system. Tiny sweat glands keep the skin on your feet supple from the inside, like a lawn kept green by sprinklers buried under the grass. Those sprinklers don't turn themselves on. They wait for a signal from a special set of nerves, the automatic ones that run things you never think about, your sweat, your body heat. When high blood sugar damages those nerves, the signal stops arriving, the sprinklers go quiet, and no amount of cream sprayed over dead grass fixes a sprinkler nobody switched on. The skin dries from the inside, hardens and splits. Now picture where that crack sits. On a heel, on a foot, at the far outpost, where blood already runs thin and the repair crew is already slow to arrive. A deep heel crack is an open door. Bacteria walk right in, into tissue that can barely defend itself. I had a patient, Eugene, a retired piano tuner from Lansing, Michigan, who came in for what he called a stubborn dry foot. That stubborn dry foot was a cracked heel that had quietly turned into an infection creeping up toward his ankle. He'd been treating it with drugstore cream for 2 months. We caught it in time, just barely. The podiatry world treats chronic heel cracking that won't answer to any cream as a real warning sign of nerve damage in older adults, not a beauty problem. So here's what to do. Yes, moisturize. Coconut oil or a good thick cream on the soles and heels every night before bed, and never between the toes, where trapped damp invites fungus. But understand you're managing the surface, while the real trouble is underneath. The deeper fix is the same medicine as before. Move those feet, steady the blood sugar, and the day you notice a crack that won't close after a week or 2, don't reach for a stronger cream. Pick up the phone. Quick pause, and I mean quick. If your feet have been trying to tell you something, and this is the first time anyone's bothered to translate it, do 2 things for me. Tap subscribe, so we get closer to that community of 100,000 people over 60 who won't be rushed. And leave 1 word in the comments. Just tell me which sign so far hit closest to home, numbness or the heels. 1 word, I read them. And don't go anywhere, because the next sign surprises my patients more than any other. It connects your feet to an organ you would never, ever guess. The third sign is the one that makes people sit back in their chair. Swelling in the feet and ankles. Sock marks that stay pressed into your skin long after the socks come off. Puffiness that's there in the morning, before you've even stood up. Most people blame the obvious. Too long on my feet, too much salt at dinner, hot weather, and sometimes that's all it is. But when the swelling keeps coming back, when it's already there before you've done anything to earn it, your feet are passing along a message from somewhere upstream. From your kidneys. Here's the surprise. Your kidneys are the body's drainage pumps. Day and night, they filter your blood and pull off the extra fluid, sending it out so it doesn't pool where it shouldn't. Think of a pump in the basement of a house, quietly keeping the lowest floor dry. Now, high blood sugar damages the kidneys the same slow way it damages everything else, by wearing down the smallest vessels until the filter clogs. The pump slows. The fluid it used to clear has to go somewhere, and water, like always, runs downhill. It settles on the lowest floor of the house, which is your feet and ankles, the outpost again, lowest on the map. Doctors call that pooling edema, which is just an old word for swelling. The puffiness in your socks is your kidneys telling you the pump is straining. And here's the part that should get your attention. If that pump keeps failing and nobody checks it, you're not looking at a foot problem anymore. You're looking at the early road to kidney disease, the kind that can end in dialysis. The swelling is the smoke, the kidney is the fire. The National Kidney Foundation estimates that roughly 1 in 3 adults with diabetes develops kidney disease, and swollen lower legs are often the very first thing a person notices, long before any kidney diagnosis ever lands. So what do you do tonight? When you rest, get your feet up higher than your heart. A couple of pillows is enough to let that pooled fluid drain back toward the center. Ease off the salt, because salt tells your body to hold on to water and makes the pooling worse. And here's the one that matters most. If the swelling is new, getting worse, or showing up in one leg much more than the other, do not wait for your yearly checkup. Call this week. One swollen leg can point to something that needs a doctor's eyes now. The 4th sign tells me, when I see it, that the supply roads themselves are narrowing. Feet that stay cold no matter what. Cold in July. Cold under 2 blankets. Cold while the rest of you is perfectly warm. People say it like it's just their nature. Oh, I've always had cold feet. And maybe. But feet that run cold, no matter the weather, are often telling you the warm blood simply isn't reaching them anymore. Think about an old house, furnace down in the basement, and one bedroom way out at the end of the duct run, far from everything. When the ducts are clear, that far room warms up fine. But let those ducts narrow and clog over the years, and that far room stays cold while the rest of the house is toasty. Your feet are that far room. High blood sugar stiffens and narrows the arteries the very same way, especially the long ones running all the way down to the outpost. The heat your body makes can't get there, not because the furnace is broken, because the route is blocked. That blockage has a name, peripheral artery disease, and it's not something to wave off. When circulation drops far enough, a small wound can't heal, tissue starts to suffer, and in the worst cases, that's the road to losing a toe. Cold feet are an early, polite warning before any of that. The American Heart Association points to peripheral artery disease affecting millions of Americans, and for people with diabetes, it's one of the most common and most overlooked complications. Persistently cold feet are one of its first quiet signals. The fix won't surprise you because your feet keep asking for the same thing. Walk, and walk with a little purpose. A brisk 20 or 30 minutes, arms moving, enough to feel your heart pick up, pushes blood down those narrowing roads and helps hold them open. Can't manage 30, do 10. The direction you're heading matters more than the distance. Lace up today. The 5th sign is the one I'd bet money nobody has ever pointed out to you. Look down at your lower legs and the tops of your feet right now. Is there noticeably less hair there than higher up your leg? Has it thinned out or vanished over the last few years without you really clocking it? Almost everyone who notices it assumes it's the socks rubbing or just one more thing that fades with age. Harmless. But it can be one of the clearest surface clues you've got. Hair is needy. Every little follicle needs a steady drip of blood, oxygen, and nutrients to keep pushing out a strand. Picture the far corner of a big lawn, the patch the sprinkler barely reaches. That's the first grass to thin, to brown, to give up. Not because anything's wrong with the grass, but because the water never quite makes it that far. The hair on your lower legs sits in that far corner of your circulation. When the small vessels feeding the outpost get starved by years of high blood sugar, the follicles there shut down first. The bare skin you're looking at is a quiet flag planted over vascular trouble that's been building underneath for a long time. This is exactly why a careful doctor actually looks at the hair on your legs during a foot exam. Research in the diabetes literature has tied this kind of lower leg hair loss to poor circulation to people with diabetes. It's a real sign. Patients just never report it because nobody ever told them it counted. So tonight, look. If the hair on your lower legs has thinned or disappeared next to the rest of your leg, treat it as one more dispatch from the outpost and get the blood test. A simple fasting glucose check is inexpensive, and for most folks over 65, it's covered by Medicare. One small appointment can tell you whether what you're seeing is nothing or something. Let's pull it all together. 5 dispatches from the outpost. Numbness and tingling, the nerve road breaking up, cracked heels that won't heal, the skin's irrigation gone quiet, swelling that keeps returning, your kidneys' drainage pump straining, cold feet in warm weather, the supply roads narrowing, and thinning hair on the legs, the far corner of the lawn the blood can no longer reach. One principle ties every one of them together. Your feet sit at the end of every line your body runs, so they feel a shortage first, long before your blood work shows a number anyone will act on. Now, here's the tool I promised you. I call it the nightly foot read, and it takes about 2 minutes. Tonight, after your bath or shower, sit somewhere with good light. Look at both feet, top and bottom. Check between every toe. Run your eyes over both heels. Press a finger near the ankle and watch for a dent that lingers. Touch one foot, then the other, and feel for any difference in warmth. Glance at the hair on your shins. That's it. Do it tonight, then again next week, so you learn what your own normal looks like and you'll spot the day it changes. And when you sit down with your doctor, don't just hand over your foot and go quiet. Ask these. 1. Can we run a fasting glucose or an A1C test today? 2. Will you check the pulses and the feeling in my feet? 3. Could this swelling be coming from my kidneys? And should we test them? 4. How's the circulation down there? Are my feet getting enough blood? You're allowed to ask every one of those. It's your body and it's your appointment. Before I let you go, I want to say something that has nothing to do with blood sugar and everything to do with you. For too long, getting older has meant getting talked past. You walk into an office, you wait, you get 15 minutes, you get a number, and you walk out with the feeling that nobody really looked at you. I spent 35 years inside that system, and I want you to hear me clearly. You are not a chart number. You are not a 15-minute slot to be cleared off a schedule. You have the right to understand your own body in plain words, not jargon tossed over your head. You have the right to ask why, and to keep asking until the answer actually makes sense to you. And you have the right to take a small, ordinary thing your body does, a cold foot, a heel that won't soften, and have it taken seriously instead of waved away. The most powerful tool in medicine was never a machine or a pill. It's a person who pays attention to their own body and refuses to be rushed. You looked at your feet today. You listened. That is not a small thing. That's exactly the kind of attention that catches trouble while there's still time to turn it around. One honest word before we part. I'm a retired doctor, and this video is education, not a diagnosis. I can't examine your feet from here, and nothing I've said replaces a real visit with your own physician. If something on this list matched what you're living with, the next step isn't to panic, it's to make an appointment and get that simple blood test. Use what you learned today to ask better questions, not to scare yourself. If this helped you, do 3 quick things. Subscribe, so we keep building this community of people over 60 who refuse to be rushed. Share it with one person whose feet have been telling them something they haven't known how to hear. And drop a comment telling me which sign you're going to check tonight. Your body is talking. I'm just helping you listen.